I'm Dr. Nilima Telang and I'm going to talk today on mucormycosis. As we know, we all are all aware that the mucormycosis was a worrisome infection for physicians and surgeons during the second wave of COVID pandemic. So mucormycosis is also known as a black fungus. It is a rare but dangerous infection. It is caused by a group of molds called mucormycetes and often affects the sinuses, lungs, skin and brain. It has a very poor prognosis with a mortality rate of 17 to 51%. Mucormycosis was previously known as zygomycosis. Mucor molds live throughout the environment. They are ubiquitous. Mucormycosis mainly affects the people who have serious health problems or who are taking medicines for longer time and whose body ability to fight the germs and sicknesses is lowered down. That is, the immunity is lowered down and or immunocompromised. It mainly affects the sinuses or the lungs after inhaling the fungal spores which are present in the environment and in the air. It can also occur on the skin after a cut, burn or other type of skin injuries. People get the mucormycosis infection by coming in direct contact with the fungal spores which are present in the environment. So now we'll go to the types of mucormycosis. There are mainly 5 types of mucormycosis which are highly pathogenic to human beings. Rhinocerebral, which affects sinuses and brain. Pulmonary lung mucormycosis. GIT, that is gastrointestinal mucormycosis. Cutaneous, that is skin mucormycosis. And disseminated mucormycosis. So now we'll go to rhinocerebral mucormycosis. So it is an infection of the sinuses that can spread to the brain. This is the most common in people with uncontrolled diabetes and in the people who have had the kidney transplants. So this type of mucormycosis was very predominant in the COVID pandemic second wave. So now we'll go to pulmonary mucormycosis. It is a lung mucormycosis, which is the most common type of mucormycosis in people with cancer and in people who have had an organ transplant or a stem cell transplantations, and these are immunocompromised. Gastrointestinal mucormycosis, it is more common among the young children than the adults. So it is also seen in premature and low birth weight infants less than 1 month of age. These are at a high risk if they have had a previous antibiotic course, surgery or medications that lower the body's ability to fight the germs and the sicknesses. It means the immunity is lowered down. Cutaneous mucormycosis, it is a type of skin mucormycosis which occurs after the spores of the fungi, they enter into the body through the break or cuts in the skin. This type of infection might occur after a burn, scrape, cut, surgery or other type of skin traumas. This is the most common form of mucormycosis among the people who do not have the weakened immune systems. And next is disseminated mucormycosis. It occurs when the infection spreads to the blood streams and it affects another part of the body. The infection most commonly affects the brain but also can affect other vital organs such as spleen, heart, kidneys and skin. So, who is at the highest risk of mucormycosis? The infection can happen to anyone at any age and of any sex. Most people come into direct contact with the fungus at some point in their everyday lives. But the persons most likely to get sick if they have a weakened immune system because of long-term medications they are taking, and they are having a serious health conditions like diabetes In those whom the sugar is not in control, HbA1c is better than 8. HIV or AIDS, cancers, organ transplant, stem cell transplant, neutropenia, that is the low WBC count, long-term steroid use, injected drug use, high level of iron in the body, that is chromatosis, bad health from the poor nutritional status, uneven levels of acid in the body, that is metabolic acidosis, premature birth or low birth weight. It is also likely to have a skin injury like a burn, cut, or wound. And the cases have been reported in people with COVID-19 infections also. So now we will go to the symptoms of mucormycosis. The symptoms of mucormycosis depend on where in the body the fungus is growing. So now we will first see the symptoms of rhinocerebral mucormycosis, that is the infection of sinus and brain. That is one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of the mouth that quickly becomes more severe, and fever. Now we'll see the symptoms of pulmonary, that is lung mucormycosis. It includes fever, persistent cough with expectoration, chest pain, shortness of breath. Now, the symptoms of cutaneous skin mucormycosis can look like hard blisters or ulcers, and the infected area may turn into a hard and it turn in black in color. Other symptoms include pain, warmth, excessive redness or swelling around the wound. The symptoms of GI tract, that is gastrointestinal mucormycosis, include severe abdominal pain, nausea, vomiting, and GIT bleeding, gastrointestinal bleeding. So now we'll go to symptoms of disseminated mucormycosis. Typically, it occurs in people who are already sick from other medical conditions. So it is very difficult to know which symptoms are related to mucormycosis. The patients with disseminated infections in the brain can develop mental status changes or even serious coma. So now we will go to the diagnosis of mucormycosis. Diagnosis of mucormycosis mainly depend upon the physical examination and the clinical history. Imaging tests like chest X-ray, CT or MRI scans. Again, the sample collection depends upon the site of infection, where the infection is, like nose secretions, respiratory secretions, tissue biopsies, etc. And histopathological and microbiological examinations are done just for the confirmation. So in microbiological examination, the samples are stripped on Saberout's dextrose agar, which is a selective medium primarily used for the isolation of fungi and especially mucor. The plates are grown, the samples are grown on SDA and they are kept at 25 degrees centigrade and at 37 degrees centigrade. Histopathological and microbiological exams show aseptate fungal hyphae, and there are various mucormycosis complications like blindness, blood clots or blocked vessels, nerve damages, etc. So the mucormycosis is a very serious and worrisome clinical infection in the for the human beings. Thank you.